Good morning, everyone. We are going to read another topic from oral pathology syndromes. In this video, I'm going to cover only 10 syndromes so that I can make the video short. So, the first syndrome is Rubinstein-Tabby syndrome, and the features of the syndrome is talon cusp, development retardation, broad thumb and great toe, delayed or incomplete descent of testes in male. Okay, so I'm going to show you this diagram. You can see this is the diagram related to Rubinstein-Tabby syndrome. You can see talon cusp, okay, and you can see broad thumb, great toes, and delayed or complete descent of the testes. Okay, so development retardation is also there. Broad thumb, okay, broad thumb and great toes. So this is the picture related to Rubinstein-Tabby syndrome. Okay, for us it is important because they can ask the question like in talon cusp, as you have read in the developmental disorder of teeth, talon cusp is associated with which syndrome? So the answer will be Rubinstein-Tabby syndrome. The second one is Gardner syndrome. In Gardner syndrome, we will see multiple polyposis of large intestine, osteomas of bone including long bones, skull and jaws, multiple epidermoid or sebaceous cyst of skin on back and scalp, and occasionally occurrence of desmoid tumor, impacted supernumerary and permanent teeth. Okay, and the picture related to with this is this. Okay, so this is the image of Gardner syndrome. Osteomas, okay, osteomas of the bone which include long bone, skull and jaw. Okay, so you can see jaw and skull bone. Okay, and then we have one more diagram, this one. So this is multiple polyposis of a large intestine. Okay, and this is multiple supernumerary. You can see over here, you can see here multiple supernumerary impacted permanent or supernumerary tooth, impacted permanent or supernumerary tooth. You can see here also impacted and missing teeth. Okay, so this is about one more diagram is also there. Yes, this is sebaceous cyst of skin. So all these pictures are regarding Gardner syndrome only. This is sebaceous cyst of the skin. This is impacted supernumerary teeth, permanent or supernumerary teeth. This is polyposis of intestine, and this is, you can see, osteomas of long bones including skull and jaw. So this is about Gardner syndrome. Okay, third one is lead. So the lead syndrome. L stand for lacrimal, okay, A stand for auricle, D for dental, and another D for digital. So what happened in lacrimal? In lacrimal sac inflammation and lacrimal gland aplasia is seen. Auricle, the ear will be deformed or it will be a cup shape. Okay, in dental you can see peg shaped teeth and there will be enamel hypoplasia. Okay, and in digital you can see clinodactyly. It means that the fingers will be like a hook. It will be hook like fingers. Okay, and the diagram related to this is, okay, so this is the diagram. Okay, so you can see over here, see L, first L is lacrimal sac inflammation, okay, and lacrimal gland aplasia. Then comes A. You can see the ear of this patient, deformed ear with cup shaped appearance. Okay, then D, you can see this D, peg shaped teeth and enamel hypoplasia or hypodontia. Okay, and this another D is for digital, clinodactyl. means the fingers will be hook in shape. So this is all about lead syndrome. Okay, now the next fourth one is Wander Van der Waals syndrome. Van der Waals syndromes. We will see this syndrome in development deformities of lip. You can see this in paramedial lip pits. Okay, it usually occurs in lower lip and is also associated with the presence of cleft palate and cleft lip. It is caused by the deletion of IQ32. Okay, and the picture related to this is, okay, you can see Van der Waals syndrome. You can see the patient is also having cleft lip or cleft palate. It is not necessary, but in this patient we can see this, and you can see this lip pits in lower lip. One more diagram I'm having. See. Okay. So if they ask about paramedian lip pits associated with which syndrome, it is associated with Van der Waals syndrome. Now the fifth one is Asher syndromes. Now this is again the development defect in the lip. It is associated with double lip. Okay, one more point is there is it is non-toxic thyroid enlargement is seen, and one more important thing is blepharochalosis. Okay, blepharochalosis, there will be fall of upper eyelid. Okay, show you the diagram related to this. Yes, this is Asher syndrome. You can see double lip, cupid bow shaped lip. You can see this topic in I have recorded one video also regarding the development deformities of lip. Okay, and then blepharochalosis. Okay, there will fall of upper eyelid and non-toxic thyroid enlargement. Okay, so this is all about Asher syndrome. Now the next is Klinefelter syndrome. This is again associated with taurodontism. We mostly get confused with talon cusp and taurodontism associated syndromes. Like they can ask taurodontism associated syndrome is Klinefelter syndromes or Rubinstein-Tabby syndromes. So we should know about this, and there will be one extra X chromosomes in this disease. So there will be XXY genetic constitution, and it will involve only male. Okay, I don't have any particular diagram regarding this, but everyone have seen taurodontism picture. Okay, now the seventh one is Peutz-Jeghers syndromes. It is also called as hereditary intestinal polyposis syndromes. In this we can see intestinal polyps and pigmentation of face, oral cavity and hands. It is autosomal dominant and caused by the mutation in serine threonine kinase 2 gene. Okay, and the diagram related to this is, see, Peutz-Jeghers syndromes. It is intestinal polyps, and you can see there will be the pigmentation of face, oral cavity, hands. This is oral cavity, this is hands, and this is face. Okay, so the next syndrome is eighth one, Wilkerson-Russell syndromes. In this you will see cheilitis, granulomatosis, facial paralysis and scrotal tongue. Okay, and the picture related to this is here. Okay, you can see scrotal tongue, cheilitis, granulomatosis, and you can see facial paralysis. Okay, this is Wilkerson-Russell syndrome. Now the ninth one is Perry-Romberg syndromes. Here you will see facial hemiatrophy, painless cleft. Okay, here it is important, coupe de sabre, near the midline of the face or the forehead. Okay, so this is the important word, coupe de sabre. You see in which syndrome? You can see this in Perry-Romberg syndrome. Now I'll tell you what is coupe de sabre. Okay, the picture related to this is this one. Okay, now you can see this is Perry-Romberg syndromes. You can see facial hypertrophy. Okay, and there, this is that painless cleft, coupe de sabre, near the midline of the face or forehead. Okay, so this is that coupe de sabre. Okay, this is important point. And the last one is median cleft face syndrome. In this syndrome, we will see orbital hypertelorism. Hypertelorism means abnormal increase in lateral distance between the orbits. Okay, median cleft of premaxilla and palate, and cranium bifidum occulum. What is cranium bifidum occulum? It is cleft of skull. Okay, you will see broad nasion and completely divided nostril. Okay, and the diagram related to this is yes, it is okay, yes. So this is the diagram related to median cleft face syndromes. You can see orbital hypertelorism. Okay, this is broad nasion and completely divided nostril. Okay, so this is all about the 10 syndromes which I was talking about. In the next video, I'll cover next 10 syndrome. Okay, thank you so much.